Welcome dear students. In this video, let us learn about chronic simple rhinitis. So the topic for this video is chronic simple rhinitis. So what is chronic rhinitis? Chronic simple rhinitis is recurrent attacks of acute rhinitis. In chronic rhinitis, there are various types. First, let us learn about simple chronic rhinitis. So, recurrent attacks of acute rhinitis. Now, the most important question is, why is there recurrence of acute attacks? There are a few predisposing factors in certain people. After rhinitis, it doesn't never completely subside. There is always a recurrence of attacks. Why does that happen? Let us look into the predisposing factors for recurrence. First and most important factor is there is persistence of infection in the nose because of some other factors such as sinusitis, tonsillitis, otitis media. All these infections are there, and so rhinitis is never completely subsiding. So persistence of infection in the nose is the first point. Second point is chronic irritation. In acute rhinitis, we have learnt about a subvariety called irritative rhinitis. Now, in some people, unfortunately, because of their occupation, they are constantly exposed to irritant gases, irritant fumes. Suppose traffic policemen or people working in some industries and factories or miners. In all these people, there is constant exposure to irritant substances, or even in smokers, not just occupationally. Certain habits such as smoke is also an irritant gas, and in smokers also this is possible. So chronic irritation from dust, smoke and other irritant substances, this is constantly irritating the mucosa, and that will lead to chronic rhinitis. Another factor is nasal obstruction because of say deviated nasal septum, or there is some synechiae. Because of that, this obstruction will always lead to persistence of discharge in the nose. Nasal obstruction. Due to DNS or synechiae or say some polyp. Any sort of nasal obstruction. There is a type of rhinitis called as vasomotor rhinitis. We shall learn about it in the subsequent videos. But for now, that is also one of the predisposing factors for chronic rhinitis. Next, some metabolic factors such as lack of exercise and lifestyle. All these factors can also predispose. Now finally, persistence of infection or chronic irritation or some obstruction, what are they all doing is, all of them will cause one single common result, and that is persistence of discharge in the nose. There is persistence of discharge in the nose. The nose is never dry. Perennially, they have running nose. And this will lead to chronic rhinitis. So, what exactly is happening inside the nose? This is the etiological factor that we have learnt. Let us understand the pathology. What is the mechanism behind all this? There is hyperemia and edema. Hyperemia is redness and edema is swelling. Hyperemia and edema of mucous membranes. In the nose. Along with this, there is hypertrophy of seromucinous glands. The seromucinous glands are hypertrophied. And also there is increase in the number of goblet cells, the cells that are present in the mucosa and submucosa. So goblet cells are also increased in number, hypertrophy of the seromucinous glands and hyperemia and edema of the mucous membranes. This is the pathology behind it. Because of all this, the clinical features seen in chronic rhinitis are, first and foremost, when there is so much of swelling, there is hypertrophy of all the glands and increase in cells, nasal obstruction is the first and foremost feature. Nasal obstruction. Second feature is nasal discharge. Now, how is this nasal discharge? It is mucoid or mucopurulent. Viral rhinitis causes watery and profuse discharge. Chronic rhinitis causes mucoid and mucopurulent discharge. Mucopurulent if there is bacterial infection. And this discharge is thick and viscid. And this thick and viscid mucoid discharge can sometimes trickle down the throat and cause post-nasal drip. It is a very annoying sensation for the patient where they feel something in the throat that cannot be spitted out, that cannot be coughed out, but something is trickling down and sometimes they can swallow it. That is post-nasal drip. Next clinical feature that we see is headache. Then when you examine the nose, what we observe is swollen turbinates. And in fact, swollen turbinates are the reason for headache because these swollen turbinates will impinge upon the nerves, will impinge upon the septum and cause headache. So, when we examine the nose, we find swollen turbinates. So, how do the turbinates look? They are dull red in color. And upon pitting, applying some pressure, they pit. They pit on pressure. And if we apply some vasoconstrictor drops, they shrink in size. Shrink in size on application of vasoconstrictor drops. Now please understand that these 2 points are very important. They pit on pressure and they shrink on application of vasoconstrictor drops. These 2 features will help you differentiate chronic simple rhinitis from certain other conditions that we will eventually learn. But please remember these 2 points. Next is, after examining the nose, if we examine the throat, once again we find postnasal drip. How do we observe postnasal drip? On the posterior pharyngeal wall, some secretions are seen. Secretions on posterior pharyngeal wall. These are the clinical features of chronic simple rhinitis. Now let us look into the treatment of this condition. First and most important thing to do is to treat the cause. The predisposing factors that we have learnt, in case the patient is being chronically exposed, constantly exposed to irritant substances, we must counsel the patient to get rid of such exposure occupationally or because of his personal professional habits. And if at all he is having tonsillitis or some other associated conditions which are leading to nasal infection, those conditions have to be treated first. And second thing that we can do is nasal irrigation. When we irrigate the nose, any superficial infections will be washed out. And as I said, the secretions in chronic rhinitis are thick and viscid. So it's a little difficult for the patient to blow them off. Nasal irrigation will help clear the nose, and it will also cause some relief in nasal obstruction. And third, we can give the patient nasal decongestants. They will reduce the hypertrophy and cause some relief. But let me talk about another important condition here, and that is called as rhinitis medicamentosa. Excessive use of nasal decongestants will paradoxically cause an increase in the nasal discharge. Now, why does this happen? Initially, we are giving nasal drops to cause vasoconstriction and so that the discharge will come down. But excessive use of this will lead to inflammation of the mucosa. If we are constantly using these decongestant drops, themselves can irritate the mucosa and they can cause inflammation of mucosa, and that inflammation will lead to nasal discharge again. So any number of nasal decongestants that you give, if the patient lands up in rhinitis medicamentosa, any number of decongestants that you give, there will be no relief in symptoms. In fact, there will be exaggeration of symptoms, and that's when we should understand it as rhinitis medicamentosa. And if the patient has landed up in rhinitis medicamentosa, we should slowly wean the patient from these decongestant drugs, and for that we can use low dose steroids. Once we start giving steroids, the inflammation will come down and we should stop using nasal decongestants. They have to be tapered gradually. So always be mindful while prescribing nasal decongestants, because there is always a risk of the patient getting into rhinitis medicamentosa. It occurs broadly because of inflammation of the mucosa. In response to decongestant drops. So the use of nasal decongestants should always be minimal and avoided if possible. And for that, we can actually give low dose steroids instead of them. Low dose steroids can replace nasal decongestants and can also treat rhinitis medicamentosa. And of course, if there is infection, bacterial infection, antibiotics are used. So this is all about chronic simple rhinitis. So broadly, it is hypertrophy of the turbinates and the mucosa that has occurred because of persistence of infection or chronic irritation or nasal obstruction, and some other factors like vasomotor rhinitis and metabolic factors. There is hyperemia and edema of mucous membranes. There is increase in the number of goblet cells, and there is hypertrophy of the seromucinous glands. Because of all these things, the patient will experience nasal obstruction, nasal discharge, headache, and when we examine, we see swollen turbinates and post-nasal drip. Most important factor is it pits on pressure and it shrinks on applying vasoconstrictor drops. And then we have to treat the cause that is causing recurrence of attacks of acute rhinitis, and we must also do nasal irrigation and keep the usage of nasal decongestants to the minimum to avoid rhinitis medicamentosa. Low dose steroids can be used instead for the same purpose, and antibiotics in case there is bacterial infection. So this is all about chronic simple rhinitis. Thank you very much.